Understanding fetal heartbeat timing in pregnancy.
Hello everyone, and welcome to our video on a truly significant aspect of pregnancy, the fetal heartbeat. In this video, we'll dive into the timeline of fetal heart development, specifically addressing the question, how early in pregnancy can the absence of a fetal heartbeat occur?
When does a fetal heartbeat start?
The journey of a pregnancy begins with conception, but the fetal heartbeat doesn't start immediately. Instead, this miraculous sign of life usually begins to beat around the 5th to 6th week of gestation, although it may be too faint to detect at this stage with most ultrasound devices. The fetal heart undergoes a complex series of developmental stages before it starts beating. At around 22 days post-fertilization, cardiac activity can be observed, but this is typically before most women even know they're pregnant.
When can we detect a fetal heartbeat?
With the advancement of technology, the fetal heartbeat can be detected quite early in pregnancy. From around 6 to 7 weeks of gestation, a transvaginal ultrasound can typically detect the baby's heartbeat. From about 8 to 12 weeks, it can be heard using a Doppler device, although this can sometimes take longer, depending on factors like the baby's position, the mother's build, and the accuracy of the dating.
When can fetal heartbeat absence occur?
Now, let's address the core of the question. When can an absence of the fetal heartbeat occur? If a pregnancy is confirmed, but no heartbeat is detected at a stage when it should be, it could indicate a miscarriage or an ectopic pregnancy. Miscarriages can happen at any time during the first half of pregnancy, but they're most common during the first trimester. An ectopic pregnancy occurs when the fertilized egg implants somewhere other than the uterus, typically in a fallopian tube. However, absence of heartbeat doesn't always mean a problem. It may simply be too early in the pregnancy, or the estimated gestational age could be off. In summary, the absence of a fetal heartbeat can be a cause for concern, but it doesn't automatically signify a problem. It could be too early, or the estimated pregnancy date might be incorrect. However, if you're pregnant and concerned about any aspect of your pregnancy, it's crucial to consult with a healthcare provider to get accurate information and guidance. Every pregnancy is unique, and this video is intended to provide general information, not to replace professional medical advice. We hope you found this video helpful in understanding the nuances of fetal heartbeat timing during pregnancy. Remember, each journey to motherhood is unique and beautiful in its own way. Thanks for watching.